So we're going to break down a room now. I'm going to grab a pair of gloves. If a glove falls on the floor, just pick it up and throw it in the garbage. Okay, we're going to start right over here. Again, we're going to use this chair cover as our garbage. We're going to take all of the garbage off of the tray and put it in here. On the dentist side, this white section can always just be thrown away. The blue big section does not get thrown away, but this teeny disposable one does get thrown away. So we're going to remove all the plastic. From the air water syringe, we're going to take off the air water syringe. You just pull that out. You put it in this little cassette cover. Make sure the instruments are in a nice orderly fashion like this. Before you leave the operatory, you want to make sure that the cassette is closed. We're going to get a couple cavi wipes out, one for each hand. I'm going to wipe off the bib clip. Anything that you might have touched, I do wipe off the keyboard and the mouse here. And then wipe off the table. Once that's been wiped off, you can put the items that you've already wiped off. This handle right here, anything that you might have touched during the procedure, just get wiped down. We're going to do a 2-wipe system. We're going to wipe everything once and then go back and wipe it again. Make sure you get all these little crevices in here that you're always wiping the cord. I'm going to take this whole set off and just clean off the cords again. I usually turn this on and off so I can get both sides of that switch. I'm going to take this off. Make sure you wipe in here. I'm going to wipe off the counter here. And then this counter, going to get that all wiped down. We're going to wipe off the x-ray head here, anywhere that we might have touched. Come out again and wipe off the handle or the little button that we push when we take x-rays. Okay, that's our 1 wipe. We're going to get 2 more cavi wipes, fresh new ones. We're going to do our 2nd wipe so that it's nice and wet for that 2nd time. Letting it sit on the surface for a couple minutes, that kills everything. And then we're also going to wipe the intraoral camera off with alcohol. If you've used this, don't put it away until after it's been wiped. Leave it on the counter so we know to wipe it off. Then it can be put back up in that little container. All right, we're going to wipe off the chairs now. You're going to use this by arrest. We're going to spray the chair, that chair, and this chair. Let's scrub that down really good. Same thing here. Let's get that wiped really well. Make sure you get the handles, because that's where patients hold on to. And you want to wipe down the entire seat, the entire chair, all the way to the base of that chair. Okay, remember to take off gloves. We're going to hold on to the end of one, bring it inside out. Hold on to this one, bring it inside out. Then we're touching the inside of the gloves to take that off and throw those away. Once you have taken off your gloves, remember you need to wash your hands. Anytime you've taken off dirty gloves, wash your hands. There's microscopic holes in all gloves, and you want to make sure your hands are clean. Okay, we're going to set up a room now for the next patient. My hands are newly washed. Make sure you have clean hands before you do any of this. You're going to grab a tray. There's different sizes. This is a really wide one. This is a narrower one. The really wide one is going to be the chair cover. You're going to open that up, shake it out, and put it over the chair. The one that's narrow, you're going to open that one up, shake it open, and you're going to place it over the x-ray head here, and we're going to tie our knot in it. Just like that. So it is nice and sturdy. The next one is the keyboard cover, and you just open this up. On one side, there is a little fold, a little lip, and you're going to take the left-hand side, place it under the upper left-hand corner of the keyboard. So it's just nice and firm up there. Then I fold over this right-hand side a little bit underneath, and a little bit on the left-hand side on the bottom. But you leave it enough on the bottom lower right-hand side to cover the mouse. Okay, we're going to open up our cassette. Throw that away. Open this up. Make sure you're opening it up the right way so those instruments don't go flying all over. Take out the air water syringe. You're just going to get that pushed in all the way so it's nice and tight. And remember there's a little lip here or a little slit at the top. That's what this is going to go through. You're going to open it up from the bottom, push that all the way through that little slit, just like that. We're going to do the same thing with this section. This one you want to twist into so that it is nice and sturdy inside there. And again, place the cover on this one. Place that up through here. Just like that. We have the Profi angle. You're just going to open that about halfway. And there's a little notch right here. You're going to place that right on this button. So just like that. And I just leave that covered until I'm ready to use it. And I open up the patient bib, and I just fold it in half. Put this on here, and I just cover my tray with it. You also want to make sure that you have floss on the tray. So I just get a piece of floss here and put that on the tray so it's ready to go. So when you bring the patient back, the first thing you're going to have them do is wash their hands. Let them know paper towels are up underneath this cupboard here. You want to get a cup out for the patient. We're going to use this pre-treatment rinse. This is really important. You're going to do 2 squirts. The patient needs to swish with that for 30 seconds. It foams a lot in their mouth. They can spit in the sink after the 30 seconds is done, but they do need to rinse with that. It just will help kill off any viruses in the mouth. Once they're done with the 30 seconds, they can spit in the sink, and then they can have a seat.